Hello and welcome to the Minds on the Frontline Podcast, a podcast dedicated to meaningful conversations that inform, educate, and inspire frontline workers, their families, and the public. Our goal is to shed light on the mental and behavioral health challenges faced by those on the front lines while providing valuable insights and real-world solutions. Minds on the Frontline is brought to you by the Frontline Strong Together 5 program. FST5 provides streamlined access to behavioral and mental health services and crisis resources for Michigan's Frontline 5 workers and their families. This includes all professional, part-time, and volunteer firefighters, EMS, law enforcement, corrections officers, and 911 dispatchers in Michigan and their immediate family members. First responders and mental health experts collaboratively created FST5 to provide 24/7 live support, effective resources, and cutting-edge services to prevent and alleviate PTSD, anxiety, depression, and other frontline work-related mental and behavioral health challenges. Need help now? If you are a frontline worker in Michigan or an immediate family member experiencing any crisis, work-related, substance abuse, depression, relationships, finances, or any other, reach out by calling 1-833-34-STRONG or go to fst5.org for more information. I'm Jeff Lassers, one of your hosts, and I'm a professional firefighter, paramedic, educator, and content creator. Minds on the Frontline is co-hosted by Mike Mattern, also a professional firefighter and paramedic. In addition, Mike is a peer support team member for his fire department and the FST5 program. In this episode, we welcome Dr. David Ledgerwood, a professor at Wayne State University and a clinical psychologist specializing in addiction research. With over 25 years in the field, Dr. Ledgerwood has dedicated his career to studying substance abuse, gambling, and behavioral addiction. In addition to his work as a researcher, he brings a wealth of knowledge of clinical experience in treating addiction and understanding its deep psychological and physiological roots. During this episode, we explore the complexities of addiction and its impact on frontline workers. Dr. Ledgerwood explains how addiction, whether to substances like nicotine or behaviors like gambling, alters brain function and why first responders are particularly vulnerable. We discuss the effects of trauma, shift work, and sleep deprivation, as well as the role of PTSD in increasing addiction risk. Dr. Ledgerwood also shares effective treatment options, including counseling, behavioral therapies, and medical interventions, while highlighting the importance of peer and family support. This conversation sheds light on the hidden struggles many frontline workers face and offers real solutions for recovery and resilience. Please check us out on YouTube, Instagram, Facebook, X, and LinkedIn, and make sure to like and subscribe to all Minds on the Frontline Podcast social media channels. Thank you, and enjoy the show. Good morning, sir. How are you?
I'm doing well. How are you?
Very good.
Yeah, great. Good.
Thank you for joining us at your own place of work, just on a different floor.
Got a couple flights of stairs in on the way up here.
Nice. So you didn't use that elevator. Good for you.
Yeah, no.
Nice. Well, before we begin, tell everybody who you are, what you do, and where you do it.
Sure. My name is Dave Ledgerwood. I'm a professor here at Wayne State University. I'm also a clinical psychologist by training. And I'm a dad of two great grown-up kids. So I'm an empty nester, and my wife and I are traveling a lot and have lots of really dorky interests outside of work.
Right, like Star Wars. We were talking about that before.
Star Wars.
That's not even dorky anymore. That's just the genre of thing people are into. The dorkiness is gone. I mean, look at comic books.
Absolutely.
It's the whole thing now. Well, you're here to talk about something pretty specific today.
Sure.
We're going to get into addiction. And like you said, you have a previous history of working in the clinical setting as a therapist and as a psychologist.
Yeah.
But you've really transitioned into doing a lot more studying, as in literal studies, gathering data specifically on the use of tobacco, gambling, in the world of addiction. So before we get into all that, tell everybody what addiction is and how it affects our brains and our behaviors.
I would say my kind of view on addiction has really sort of shifted over 25 plus years of doing this work. And I started as a graduate student here at Wayne State, moved away and came back. But what I've really, I think, come to understand is, we often think of addiction being related to things like alcohol, drugs, that sort of thing. But addiction is also something a word we can use to describe a compulsion to engage in other types of behaviors like gambling and shopping and compulsive pornography watching, or even eating, certain types of food. The word addiction is something that fell out of favor for a long time in our field and is sort of coming back now. And the word itself literally comes from the Latin, literally means to be bound to or to be enslaved by. Right?
That's pretty spot on.
Yeah, it's just exactly it. We, for years and years, we thought of addiction in terms of words like substance abuse or substance dependence, where a person would, abuse a drug and engage in reckless activities, or would need the drug to function, or would need increasing amounts of the drug, and or that sort of thing. I think our view is broadening just a little bit, but it really still encompasses those things. But now we sort of talk about it in terms of substance use disorder, or tobacco use disorder, or alcohol use disorder, or gambling disorder, or things like that.
Give me some objective reasoning as to classify them differently. Is it to be more specific as to what they are?
I think it's just a matter of that word addiction sort of coming back into use, because it does really sort of characterize that element of being bound to or enslaved by either a drug or alcohol or a particular type of behavior. But there are specific characteristics that I think still make up that definition, like things like, being with gambling, for example, being completely preoccupied with making your next bet, or with any of those substances, needing to either use more and more of the substance to get the same effect, or needing to engage in the activity more and more to get the same feeling as when you first started doing it. So that idea of increasing tolerance, or withdrawal effects, for example. Like, for example, when you stop smoking, you want to rip everyone's head off, or you stop gambling, you get really irritable and want to get back into it, that sort of thing. All those elements are still part of the definition, but I think our view and our names have sort of shifted just a little bit in the last 10 or 15 years in terms of sort of, and I think that's led to a bit of a change in how we sort of viewed addiction, and that idea of addiction coming back as a term that we would use sometimes.
When we start talking about addiction and all these different things, why would you say that frontline workers have this high risk for addiction? I mean, is it something like the stress, the trauma, the shift work? Like, in your opinion, why is the frontline community it's more common within that community?
It can be pretty common among frontline workers, for sure. What we definitely know among anybody with an addiction is if you have a history of trauma that leads to, say, post-traumatic stress disorder, that can really increase your risk of developing an addiction later in life. We've seen that in hundreds of studies. And of course, a lot of times frontline workers are predisposed to post-traumatic stress disorder because they're exposed to a lot of trauma as a part of their day-to-day work. So what we understand from literature on, for example, studying addictions among people who are frontline workers is if they experience a lot of these traumas and a lot of these stressors every single day, that makes them a little more vulnerable to developing addictions, and particularly when they also develop post-traumatic stress disorder. That seems to be the big key. And post-traumatic stress disorder, as I'm sure your listeners know, is a huge problem among people with who are frontline workers as they're exposed to those traumas.
Yeah, and it seems to be a spectrum in that PTSD, you could have a variation of intensity and degrees based on a number of incidents.
Yes.
Notably, usually one specific triggering incident that is then manifested later amongst many others.
Absolutely.
So, yeah, I could see the tie. But can you help us understand physiologically what's going on? So I go through all this PTSD or trauma, any human. Let's not just say first responders yet, but let's say all the humans that can endure trauma. We all know as humans, we all have some variation of that, some in a much worse than others.
Right.
What happens in our brains?
I'm sort of thinking more in terms of the addiction side. Trauma really predisposes people to addiction, but trauma is not the only thing that predisposes people to addiction. Being exposed to other people using substances or engaging in gambling or other types of addictive behaviors is another risk factor. Other risk factors might be genetics. People might be predisposed to developing addictions more so than other people, and so forth. But how this sort of works is people, when they have, say, post-traumatic stress disorder and they having difficulty coping with life on a day-to-day basis, they might use alcohol or drugs or gambling or other things to try and cope with whatever's going on with them. I believe one of the things you were asking about was, say, shift work or sleep and that sort of thing. Sleep is a huge factor, a huge important factor in terms of our mental health and our psychological health. If we're not getting enough sleep, we're not going to handle stress nearly as well as if we are sleeping well, right? So we get a lot, it's one of those cornerstones like sleep and pain and exposure to trauma and all of these things that really kind of feed into how well we do coping with stress on a day-to-day basis. When we're talking about addiction and how the brain works, for example, you get to that point where you start using that substance over a prolonged period of time, the use of the substance starts to hijack the brain in terms of how we process rewards in the brain. So there's certain structures in the brain, I won't get into all of those, but different areas, like one area called the striatal area, one called the frontal area, like the amygdala, a couple of other areas that basically are a bunch of circuits in the brain that help us to process learning from our environment, learning consequences from our actions, and what we get rewarded by and what we get punished by, right? And our brain, various parts of our brain work together to try and understand how to respond to, say, reward or punishment, how we can get more reward and less punishment, and then how we react to those things emotionally and how we store those things as memories, right? So we can remember in the future, if I drink when I'm stressed out, I can sleep better. Something like that, right? If we do that over and over again and we use drugs to cope with problems like not being able to sleep or dealing with stress or that sort of thing, eventually the use of the drug hijacks that normal process, right?
You've replaced your normal operating system with an exogenous chemical that is now running the show in a lot of ways, or at least you're leaning on it in a way where you're not running your own show very efficiently.
Right.
And once that exogenous chemical's gone,
right. Well, the chemical's still there, but it's being sort of
I guess when you
activated by the
stop
substance.
feeding it, right? And then you have a disruption in a homeostasis that you created.
Yeah.
It's not a good homeostasis.
No.
So you have this new normal that stinks.
Absolutely.
And then once that's unavailable to you, then you're going to have a downward spiral.
Yeah, and especially when you end up becoming physiologically dependent on the substance or the activity. When you don't have it, that activates all those stressful experiences and you feel like you need it to actually get back to a normal state, whatever that might be.
Because you've included that chemical in your normalization, de-stressing practices. It's a bad crutch.
Right.
It's not a good coping mechanism.
Right. And certain things, for example, like if you think about cigarette smoking, that's a great example of how, once you sort of become addicted to cigarette smoking, the level of physical dependence in your brain makes it so that if you were to stop smoking for a day, you're going to feel horrible.
Right.
Wow. Right.
Yeah.
That's true for many chemicals and the variation of that.
Now, I had a follow-up question to this because we've talked a lot about on the podcast and about how a lot of first responders have a lot of childhood trauma, and that's what leads them to the first responder community. Does that also increase the predisposition for addiction later in life? It's not just the trauma from the job, but it kind of stems from that childhood stuff as well. Yeah,
given that PTSD can be one of the several big risk factors for developing addiction, and childhood trauma often will make it more likely that people might develop PTSD in response to adulthood trauma. So if you've experienced a lot of trauma as a kid, and then you get into this line of work, and then you exposed to a lot of trauma as an adult, you could be at more risk of developing PTSD. And then it's that risk of having PTSD that also puts you at risk of addictive behaviors.
So you get it as a kid, you don't have the coping mechanisms per se, but when you get to an adult, now you're offered all these.
Yeah, it's a multifactorial problem being thrown at you, and along the way, you're going to have lots of opportunities to have crutches along the way that if you accept, they might grab you.
Potentially, yeah. And I would also say that everybody's different.
Right.
So, like, I mean, it's entirely possible to develop an addiction without post-traumatic stress disorder.
Absolutely. Yep.
It's impossible. It's entirely possible to develop PTSD as an adult, having only been exposed to trauma as an adult, without having childhood trauma, and so forth. It's also possible to develop PTSD when you're young and that carry forward. So it really is individual, right?
Yeah. But, what would you say in your experience would be the most common addictions with first responders, and why are those so prevalent?
I think that the most common addictions are the same as with other populations, like cigarette smoking and tobacco and nicotine use is huge.
Although we have seen cigarette smoking going down in the younger population, cigarette smoking, that doesn't mean not nicotine or tobacco.
Yeah.
I just said cigarettes. That has gone down.
If you think about, like, in the 1950s, maybe about half the population smoked cigarettes.
Yeah.
About maybe 12% of the population smokes cigarettes now.
Good.
Adult population in the U.S.
That took a long time. I remember the trials as a kid, and they were bringing all the CEOs. I remember that.
Yeah.
And it took this long to get down to 12%.
Very long time, yeah.
But in the meantime, they made a lot of new stuff. So you also said nicotine. Now, I will also say I chewed. I was a Skoal guy. I was a Kodiak guy. I was even a Copenhagen guy.
Okay.
For 17 years. And I think after year 1, I tried to quit. I probably tried to quit 17 times. And eventually I did. Right?
Okay.
So luckily I didn't do anything magic. I had kids.
What made it hard for you to quit? Sorry,
Everybody,
I turned the tables on you.
Please do.
No,
it made it
good.
hard for me to quit because I was always looking for something to solve that. This is a dip job. So if I was mowing the lawn, if I was doing anything,
You need that burst, that rush.
that's a dip job. Well, it was just how we did it culturally at the firehouse or in the hockey rink. How many guys did you play hockey with that were chewing and spitting?
Yeah,
right?
For sure.
That's
Actually,
that same group.
Hey, I grew up in the 70s and 80s, so I had the parents smoking cigarettes at the side of the rink indoors. So.
Exactly.
Oh,
yeah. My
Get a nice
baseball
haze
coach
over the ring.
Yeah, that's
I
right.
remember Coach Dave. He was a baseball coach. He's always had a cigarette in, yelling at you from the first baseline. It was and drinking a beer.
You got to first base, and the first base coach had one hanging out of his mouth.
And nobody said boo.
Yeah.
That's just what he did. But yeah, it was hard for me to quit. I think I liked it. It was a social thing, hanging out with the buddies. My girlfriend, then wife, didn't care.
Okay.
That helped, when they're not on you about it.
Yeah.
And then I just looked at my little kid one day at 6 months old. I'm like, I got it. I don't like her looking at me with this thing in my mouth.
Of course. Right.
And so I kind of did it because I wanted to show my kids that nothing can own you.
Yeah.
You can get rid of it. But not everybody has that epiphany, and not everybody has that type of healthy leverage in their life. They're still in the things that kept me out of it, right? So
you described most of the reasons why people smoke and why people use tobacco products, and also why people quit. In addition to the fact that it's a physiological thing, the longer you smoke, the more dependent your body becomes on nicotine, and the harder it is just physically to stop using it.
yeah, and you described almost 20 years of my life.
Yeah, there you go.
It was a love-hate relationship.
Yeah. When you quit smoking or using a product altogether, how long did it take you to get through that withdrawal?
I'd say 6 months.
Okay.
3 to 6 months of I didn't like, and now if I smell it, I'm repulsed by it.
Yeah.
It's almost like my body did so much work in the meantime where it's we don't want that anymore. So once in a while I'll smell somebody's tin just to get a whiff, and I'm like, oh God, that's disgusting. And it's good because I think, when you do the early 20s thing, back in the day we used to go to Ontario and you're 19. You go across the border, you do the thing. Well, what do? You grab your smokes, you grab this, you're 19, you're stupid, you're going to go drink at the bar.
Yeah.
Right? And next thing you're smoking these stupid cigarettes. And you stink like cigarettes, and it's all gross. And then eventually I stopped doing that, and then I was like, oh, it's disgusting. It smells here, right? So it's that same reaction you have to kind of quitting something, and you become this drug dog to it.
Yeah, of course. And then every time you smell it or catch a whiff of it somewhere, it's like, oh God, recoil, right?
And now it's changing because they're not using so much of the old school flavors that I remember smelling. Now we've transitioned to this more spitless tobacco, I guess, the Zins, the Rogues,
right.
all that.
Yeah.
There's tins everywhere. You know, all over. And I'm not just saying in firehouse. I'm saying in life. There's tins everywhere.
Yeah.
And so I'm glad I quit before the availability of increased use.
Stuff.
Yeah. I don't need vapes. I don't need any of that.
The thing is, we know that cigarette smoking actually causes 1 in 6 preventable deaths in the United States still, even though the rate is only about 12% of the population. So if we're able to get people to quit smoking, then we could substantially, improve people's health and so forth. What we also know is there are health risks of things like chewing, tobacco, other smokeless products like the Zins, and vaping. They're not safe necessarily. They, in some circumstances, they may be less dangerous than cigarette smoking. But one of the things that we found is that if people say use a vape to try and quit smoking, the vast majority of people will start smoking and using the vape. So they become more dependent on the nicotine, and it doesn't help them to quit smoking cigarettes. So sometimes it doesn't benefit people to say try and switch to the vapes.
Yeah, a lot of times people are just replacing cigarettes with, the Zins or whatever it might be, and they're like, well, I quit smoking.
Right.
You really didn't quit. You just kind of moved it over here. You know what I mean?
Yeah.
You stink less.
Yes, yes.
You've improved it for me.
Yeah. So what would you say is the most effective way when we're talking about nicotine or any of this stuff?
Sure.
For you to get over it or get past it?
What's the approach?
So I will say I'm not a physician. I can't prescribe. I'm a psychologist, so take that with a grain of salt. But what the current state of affairs is, there's certain medications that can help you to quit smoking. There's nicotine replacement. Often you think of like nicotine patch, nicotine gum, lozenge, so forth. Most physicians these days will suggest to you that you use what we call a dual approach. Put a patch on all day for sort of steady state of nicotine, and then use a lozenge or a piece of gum when you have a breakthrough craving, right? When you experience a craving. There's also medications, a medication called bupropion, which some people might have known as under the names of Zyban or Wellbutrin. It's prescribed as Wellbutrin for depression often, Zyban to stop smoking. That's a medication that's not as prescribed as often for smoking these days, but it's very effective. And then, of course, there's Chantix or varenicline, which many of you have probably
remember the commercials for all these.
Yeah, of course.
So, I have heard some people say they did not feel good mentally on those.
Mentally, like in terms
they
of...
did not like crawling out of their skin, feeling anxious.
Yeah, I hear less of that. What I hear most people say on varenicline is sometimes it can cause an upset stomach. And sometimes it could cause unusual dreams, vivid and unusual dreams. Those are the two that I hear the most frequently with Chantix.
But like any medication, it can include anything.
Yeah.
Right? I've seen people have horrible reactions to Zoloft, and other people have really good ones, right?
Yeah. A lot of people won't experience any of those things, and maybe it'll be something that you can tolerate or can't tolerate. But what that medication seems to do is if you smoke a cigarette, you'll just look at your cigarette and say, why am I doing this? You don't get the taste out of it. You don't get the buzz out of it, the rush out of it. It sort of takes the joy away from smoking.
Why is it just smoking? What about everything else?
Well, it's specifically focused on a receptor in the brain that is a nicotinic acetylcholine receptor, which focuses, binds to nicotine, right?
So it's
nicotine
not like removing all joy stuff.
Yeah. It's all about the nicotine piece.
You're hitting a very specific receptor.
Yeah, exactly.
That we're trying to fill, so you don't try to fill it yourself with the actual chemical.
Yeah. So if you think about like the patch or the gum, that's putting nicotine in your body, so you don't need the nicotine from the cigarette you don't go into withdrawals. Whereas this other medication also prevents withdrawals, but it makes it so that if you try and smoke a cigarette, you're just not going to get any joy from the cigarette.
Okay.
First of all of this consult with a doctor, but these are medically approved ways that you can go through this process, and they may or may not work for everybody.
Yes, but I would say the number one thing that you need to quit smoking is you need a desire to quit smoking. You need to want it, right? Use these as tools, but really... people who quit smoking are people who really want to for some reason or have to quit smoking.
Yeah.
Right.
Okay. So that kind of summarized a lot of the nicotine, the smoking, the vaping, all of it's in that bucket. Would you agree?
Absolutely. Yes.
All right. So we can put all that in bucket that it's not good, especially the smoking we know is like you said, 1 in 6 deaths, or at least related to 1 in 6 deaths in America right now. That's insane. But, and there's a lot of people that are not medical people saying the benefits of nicotine on the human brain. Can I touch on that real quick before we move on to gambling? There's a lot of this nootropic talk in nicotine. It's good for me. It increases testosterone. Like I've heard these claims from famous people,
Right.
and it sounds cool on their podcasts, right? But I could also see people taking advantage of bro science to justify the use of more nicotine.
Yeah, bro science is usually wrong.
Usually,
Yeah.
yeah.
You know, what happens is sometimes people will say, you know, when they start smoking or using tobacco products, they'll say, you know, I use it because I get more mental clarity, more acuity, and more bit of a rush.
Writers.
But ultimately, the longer you go, the more that dissipates, and you become physiologically dependent on the substance, the nicotine. And then you need to smoke a cigarette or use nicotine just to be almost normal. So you kind of screw up your system, right? It just messes things up eventually. It may give you a bit of a rush early on, may give you a bit of mental focus. But if you know, it's I would say smoking in particular is one of the most addictive things you can do. And most people who pick up a cigarette and start smoking regularly will become dependent on nicotine. Then you're not functioning well.
Mm-hmm.
Right?
Oh, yeah.
And that's true if I'm just ingesting just nicotine, just concentrated nicotine. Like there's nicotine sprays.
Yeah, I wouldn't. I mean, you know, if you're doing that on a regular basis, you'll become physiologically dependent on nicotine.
Okay. And with the benefit of you feeling good about going through this task may be outweighed by the fact that the dependence on this, like anything else.
Yeah.
If you're going to lean on something so hard as a crutch, eventually that crutch could break. And now what are you going to do?
Exactly.
You got to have a backup plan.
Right.
And I don't think what we're saying is nobody expects anybody to not use nicotine ever.
Right.
I like cigars once in a while.
Sure.
Is it, right? But it's not like
absolutely.
every morning. Yeah.
Yeah.
Me and him went on a trip to Indianapolis to a convention. We had a nice little cigar. It was great, right? That's people bonding moment. It's not an everyday activity. I think we're all kind of getting that, as we don't want to admonish anybody for doing any type of behavior that you're bad. No. It shouldn't own you.
Within moderation.
Well, that's the thing. It's not about the person. It's about the fact that, you know, particular ways of using nicotine tobacco products can very well lead you to be dependent on those products.
And you should be in charge.
Yeah.
Yes.
All right, let's get into another thing that can lead to addiction. Then enslavement. Gambling is everywhere.
It is.
Everywhere.
It is.
So not only is it available in casino form in many states, like Michigan, we had a very big burst of multiple casinos here in Detroit.
Right.
And then on top of that, gambling online through your Black Mirror in your pocket is pretty easy now.
Right.
So let's go over that. Gambling addiction doesn't get as much of attention as substance abuse, but I think that's changing pretty rapidly with the availability of it.
It is, yes.
So what makes it particularly concerning as this develops?
Well, you know, it's really interesting because it's the first disorder that's been sort of recognized as an addiction by the American Psychiatric Association without it being involving ingestion of a substance.
Wow.
Right?
Wow.
So with alcohol, with tobacco, with cocaine, with heroin, you're taking some kind of substance, putting it into your body. Gambling is the first behavioral addiction recognized.
Not even like sexual addiction and stuff like that?
They have not been recognized. The only other behavioral addiction that's actually been at all recognized by the American Psychiatric Association is internet gaming disorder, which is in the section of the DSM that's titled for future study. You know,
So we know what the DSM is. So give everybody an overview of what that means because it's coming out of the Google of it.
Yeah, the Diagnostic and Statistical Manual for Mental Disorders, which is what
the book.
It's like what we use in North America to understand what mental illnesses are and what, you know, how to code them and what the symptoms are and all of that. So gambling disorder.
To get there, and sorry to interrupt you, but to get there, you got to have enough data to show that it's real.
That's
you don't
right.
just get to go in there because somebody thinks it.
Yeah,
Right? So
and you have to have research in so many different areas. Like, for example, does your brain react in the same way as it does to cocaine use disorder? Does do you use the same sorts of treatments? Do you have the same sorts of co-occurring problems? That sort of thing, right?
Okay.
Yeah.
How long ago did it finally get
In 2013.
Oh,
Yeah.
okay.
So it's been,
Wow.
Yeah, a while ago, like 13 years ago or 12 years ago.
I mean, I would say that predates the online where we're at now.
Well,
even.
yeah,
You know
that's what I
I'm
mean.
saying?
That's why I'm so surprised.
It took decades of research to get to that point. So, and you got to think about like the landscape of the last 5 years. You know, we had the pandemic, everyone was at home. During the same period of time, we see a huge proliferation across the United States in the legalization and distribution of online gambling and particularly online sports betting, right? So over the last 5 years, we've gone from maybe, Vegas and a couple of small, things that were legalized in the United States to most of the United States having online gambling, oftentimes owned and run by the state governments or, companies that have been allowed to come in. And when you watch sports sports game or sports match on TV, every second commercial is for an online gambling company.
He just showed his Canadian by saying sports match.
Yes, sports. But I mean, but
I was gonna pick on hockey, but then I'm like, well, but then football.
Well, I mean, even you look at the channels. I mean, Bally Sports.
Yeah.
Now it's FanDuel.
Yeah.
You know what I mean? All these sports are sponsored by online gambling.
It's paying the bills for a lot of
Yes.
things. It's the thing making money hand over fist right now.
So we used to, like, I drive past 4 gigantic casinos on my way to work every day.
Yeah.
But and that used to be the thing I would point to as being the high risk thing. But now I've got a casino in my pocket.
Right. Right. Well, I don't go downtown very much. I don't have to worry about it. Well, now it's downtown's in your pocket.
Right. Yeah, absolutely.
Yeah, and then there's lots of states that don't have casinos like Southeast Michigan does, right? So imagine now everybody else the availability of it and the revenue being made.
And availability is a huge factor, a risk factor for people.
Right.
So along with those other ones that I mentioned.
Yeah, the barrier to entry is extremely low.
Right.
It's you got to prove you're of age.
Yeah.
And you got the cash to play in.
You gotta put some cash in and go. Yeah.
What are some of the signs that not only the family but coworkers or anybody should be looking for when we're talking about gambling addiction? What are some of the things that they're going to see right off the bat early on, and then as they get deeper kind of into this addiction?
Sure. Well, a lot of times, people will sort of start to develop a gambling problem after they've experienced some kind of big jackpot, big win. That can be kind of a high risk time for some people, especially, you go to the casino and you put some money in and you like win $1,000. That will start getting people to start thinking that maybe I can make some money doing this.
Start chasing that first high again.
Chasing that first high, which is chasing is a big part of problem gambling. People will chase that will actually usually chase their losses. Okay. So when they lose money, they'll put more money in to try and recoup what they've lost. But if you're talking about family or friends and what they might see, you might see that the person is becoming more and more preoccupied with gambling and different types of bets and that sort of thing. They may start not engaging in activities with you that they used to, like family outings or things with friends. You may start becoming aware they have money problems. You may become aware that they may be gambling with increasing frequency and increasing amounts of money over time, to the point that you might be worried that they're spending more than they can really afford. And eventually you might get to a point where you're finding that your friend or your family member is hiding the extent of their gambling. So those are some of the big signs. I've worked with family members, for example, who've become very concerned that maybe the person with the gambling problem is starting to take money out of important family bank accounts or take out of 401k accounts or take out credit cards or other things to support the gambling. Those are huge red flags for a family member.
Coworkers, family members, as they're seeing these types of things, what now, like what can they do at that point? Like what resources are available when it comes to the gambling addictions? If
you're aware that you have a gambling problem, I would 100% recommend that you get treatment. And there is free treatment in the state of Michigan. What you do is you call the 1-800-GAMBLER helpline. That's actually a national helpline that will connect you with an agency here in Michigan that's funded through the state. They'll ask you if you have health insurance. If you have health insurance, they might refer you to a provider in your health provider network. But if you don't, they will try and connect you with a clinician who is certified to treat problem gambling here in Michigan, close to your home. So there are resources out there. The other things that I would suggest are things like self or mutual help groups like Gamblers Anonymous. Gamblers Anonymous is available. Other types of recovery groups are also available out there. I would also suggest, you talk to your family, you talk to your spiritual advisor, you talk to your doctor. There are some medications that are, although not necessarily approved by the FDA specifically for gambling, have been shown to be helpful in addition to counseling. But counseling is number one. I would definitely recommend getting some sort of help from a professional who's actually certified to treat people with gambling disorders.
And give us a brief overview as why that specific
because
thing.
It's effective. because the research
because it works.
Because it works.
I like that, but why does it work? I guess is what I'm saying.
It works for a lot of reasons. I as a clinical psychologist, I've been doing both clinical, psychotherapy with people for decades, but also clinical trial research where I look at how effective these interventions are. And what we know is certain types of psychotherapy, well, really most type of psychotherapies, but psychotherapies that include being able to talk to somebody and develop like a solid, trusting relationship with an objective person who you can kind of bounce these things off of is extremely effective in helping people to reduce problematic behaviors like gambling. I mean, it's been shown for not just gambling, for like depression, for anxiety, post-traumatic stress disorder, for other addictions, all of these things, psychotherapy works. And within the state of Michigan, the Michigan program will refer you to a treatment provider that's actually had specialized training in treating people with gambling disorders. That doesn't mean that other providers, say through your insurance network, would not be able to help you. They certainly would, but within the state program, these folks are trained to help people with gambling disorder.
They've been vetted. They know that this is for gambling. They're great. They're phenomenal. So it's a lot easier to go through that number because you're getting specifically what you're looking for.
Exactly.
Whereas if you go on your own, you're kind of shooting in the dark a little bit.
I mean, I would say most sort of the licensed psychologists, licensed psychiatrists, licensed social workers, especially if they have a history of treating people with addictions, will give you good care, excellent care. Yeah.
Okay.
So let's parlay that into the final question here.
No pun intended.
No, pun was intended very much. Pun very much intended. What would you say to first responders and their families if they have a family member who is struggling in silence or unsure, any addiction? Give us those final thoughts on the steps moving forward.
Well, sadly, a lot of the things that we do see is oftentimes the family member or the friend is very, very concerned about the person that might have an addiction, but that person with the addiction is not ready to get help. And that is an incredibly difficult situation. I would say that for that family member or friend, there's actually help for you. The state program that I mentioned for gambling, for example, also offers counseling to family members who might have a loved one with a gambling problem. So you can get some advice, you can get some guidance, some support from a therapist to, you may not be able to force the person into treatment, but, I think it's important to know that there is help out there for you, support out there for you. In terms of trying to support a family member or friend to get into treatment, you can encourage them. I think you can enlist the help of friends and relatives to help you encourage that person. I think there's certain things that you really don't want to do. For example, you wouldn't want to bail out your friend who has a gambling problem if they get in trouble with money, that sort of thing.
Yeah, you don't want to be lost on because he's going to lose it anyway. Even if he makes it, he or she wins, they're going to lose it again.
Yeah, and you don't want to enable the gambling problem.
Right.
But trying to encourage them and help them to get the support that they need.
You don't want to be their nicotine patch for gambling.
Or the piggy bank.
Right, all the things.
Yeah.
It's not like this is their last one.
Yeah.
In fact, you're just making it harder.
Exactly.
Well, those are amazing words for everything, and we truly appreciate you having here. We're going to have you back, because I think there's a lot more conversations to have here.
Absolutely.
And then bring in some other experts and kind of leverage both your brains together.
That'd be great.
Yeah, we appreciate you coming on, your time and your expertise.
Well, thank you very much, guys.
Thanks. Thank you.
All right.
Thank you for listening to the Minds on the Frontline podcast. We have more great content coming out soon. Please check us out on YouTube, Instagram, Facebook, X, and LinkedIn. And make sure to like and subscribe to all Minds on the Frontline podcast social media channels. Thank you, and have a great day.